morning. My name is Athena Valerio-Hirschfeld, and I am a paramedic lieutenant with Albuquerque Fire Rescue HEART program. HEART program's been in existence since July of 2018, and it stands for Home Engagement Alternative Response Team. The HEART program was designed to help facilitate better resource finding for those individuals who call 911 and those who need more long-term assistance. The HEART program's most current or most recent program is the Home Modification or Fall Prevention program, and I'm the coordinator of that program. Our home modification aspect of our fall prevention program, we partner with Senior Affairs to help install grab bars, raised toilet seats, bed rails, small home modifications which allow us to help keep people as safe in their home as possible. And we have a carpenter that goes and does that work for us. I schedule it, but he's the one that goes out. The second component of our program is the Fall Recovery Plan Be Brave class. And this class, we were able to teach a few at local senior centers earlier in the year, but due to COVID, we've kind of held back, and we hope to resume those as soon as it's safe to do so. But we are going to go over some of the Be Brave Fall Recovery Plan aspects here today. Just as a reminder, because really fall prevention starts before a fall even occurs. Now, when we think of falls, we tend to think of those ones that break a hip, break a leg, those really severe ones. But falls happen all the time, from when we're first learning to walk to when we're 70, 80, 90. But we really tend not to do anything about it until we experience that one big fall. So we want to prepare ahead of time, which actually will help us reduce our likelihood of falls. So when we talk about our fall recovery plan, we have a nice little acronym. It's called Be Brave. B-E-B-R-A-V-E. So the first part of Be Brave is to brainstorm. When we're talking about brainstorming, this happens when you're in your home. Brainstorming has to do with talking with your physician about medications that you're taking, the ability to walk around, your eyesight, thinking of all the questions that you may have and wanting to discuss those. It also involves talking with your pharmacist, looking at the medications that you're taking, seeing if they overlap, if they have negative consequences with each other, if you're taking too many or the dosages aren't right for where you currently are. We also want to look at your home. So do you have a wide enough walkway for you and your walker to get through, or you and your pet? And if you do have pets, if they like being at your feet, are there bells on them? Do you know where they're at? We tend to trip on them just because they want to be near us, but we want to know where they're at too. This can also include the outside safety, your walkways, ramps, stairs, grab bars, whether it's to get in the house, your bathroom, anything like that. We also have a couple different components that help facilitate 911 services, and that is something called the Vial of Life form. And this is a single page document that has your name, your birth date, your past medical history, your medications, your allergies, hospital of choice, as well as things like if you have dentures, if you have a DNR or advanced directives. And that's housed on or near the refrigerator, so if 911's initiated, we can find that information and get you the best assistance so we know kind of what your medical problems are. We also want to consider developing what we call a buddy system, in the sense that I personally live alone, and so if something were to happen to me, someone may not know to come check on me unless I don't show up for work, but do I have someone that I check in with fairly regularly? It may not have to be every day, but if they don't hear from me Tuesday, when they always hear from me on Tuesday, they can start looking in to see if I've had some sort of medical emergency, if I've fallen, if I'm not safe, or maybe I just forgot it was Tuesday. But by connecting and having that greater sense of community, that gives us a greater sense of peace and safety. The E of B is to execute. So we just talked about these great ideas to brainstorm, but they're only great ideas unless we actually follow through on them. So we do want to make a list of questions to ask our doctor, so on that next appointment we can actually ask them, and instead of getting off the phone and being like, oh, I forgot to ask him about those medications. We want to request a vial of life form. That can be done through Senior Affairs. It can also be done through the Heart Office. You can also find it online. We want to look at what other components, right? So what are those friends or neighbors that we have around that we can contact and talk with them about it? And that creates their safety, it creates my safety, but we actually want to follow through and start that habit. One thing that I forgot in the brainstorming, but we can also execute, is that your local senior center has great movement classes to help keep you as active as possible. So when we are thinking about our overall health and well-being, we want to keep moving and keep active, doing the things to keep us safe in our own home. And whether that's a Tai Chi class or the gentle stretch or whatever our options are available, hopefully soon in person, but at least now with videos, that we follow through on that. It can be scary trying something new, but that's really the best way to start improving our overall health and well-being and preventing those falls in the future. Now, the next part of our acronym, the BRAVE part, has to do with when we actually fall. So the B stands for breathing, and we're going to do a little exercise here today all together. And for this, it is one of those things that unless you practice, you won't remember it. So whether you're sitting or standing, I encourage you to sit. We're going to sit so our feet are firmly on the ground. We are sitting at the front of our chair so you can feel your sits bones or your butt cheeks on the ground or on the chair there. I want you to lean slightly to the left, and I'm going to over-exaggerate here. And we are going to have our mouths closed. We're going to inhale through our nose. We're going to P-A-U-S-E, and then exhale through your mouth as if through a straw. Good. We're going to do 2 more of those. So we're going to inhale. P-A-U-S-E, and we're going to exhale. Last one. P-A-U-S-E, and then exhale. Good. What did you notice with that? I know for me personally, I feel a little bit more grounded. Everything's just kind of slower motion. So after a fall, I can practice this breathing. I go from an excited state to a little bit more calm so I can think through what just happened. And so this is something we want to practice every day. But if you notice that you are a little bit dizzy or lightheaded after doing that breathing exercise, don't do so many at a time, but work your way up to it, because it's an indication that your oxygen in your blood is a little off. So we do want to practice that. Now that we've breathed and we've kind of calmed down, the next portion is to remain positive, right? So I want you to think of Pollyanna and just look on the bright side of life. If we can breathe and we can start thinking, things are pretty good. It may not be ideal, but things are pretty good. All right? Then we want to assess. Now this assessment more than likely will be on the ground when we do this, but you can assess even now while you're sitting. Move your arms, move your legs. How do they feel? If I turn and I always have a back pain right here, if I find myself on the ground and have that pain, that may not be new. And so it's not as concerning as if I turn my head and I get a sharp pain, which I've never experienced. That's going to change how we do things. We also want to assess our surroundings. So are we inside? Are we outside? Is someone nearby? Is it daytime? Is it nighttime? Winter, summer? All those things are going to change in how we interact with the next steps of how to move and get to safety. The V in BRAVE stands for venture to safety, And that's going to be based on your assessment. In the class, we go over more of what some of these things are, but just to start thinking about it is if I live alone and it's the middle of the night, I don't have a phone nearby, I may need to crawl, move, scoot, roll to someplace where I can call someone. If I'm outside and it's the middle of the afternoon, there might be walkers to where I don't necessarily need to move, but I can call out for help, which leads to our E, which is to engage help. Engaging help sounds a little awkward, but it works well for my acronym. And so when we engage help, we want to think about who we can call. Is there a neighbor? Is there a friend? Is there family members? You know, does my niece happen to be staying with me that night and she's just in the next room? Or do I need to make a phone call? 911 is also a possibility, but when you call 911, remember that we can't tell you if you're okay. Our goal is to get you to the emergency room so they can do scans and tests. So 911 is certainly an option, but just remember, we can't tell you to give you a clear bill of health. You always want to follow up with your doctor as well. That's part of engaging that help. Because if I'm noticing I'm stumbling and falling more, that could be an indication of a change in my overall health and well-being that we want to address. And so we want to remember to be brave. So that's going to be brainstorm, execute, breathe, remain positive, assess your body and your surroundings, venture to safety, and engage help. And really, when we want to be brave, it's those small steps that are before a fall that lead to greater resilience and our overall decrease of fear of falling, allowing us to stay as independent and mobile and doing the things in our life that we want to do. I thank you for your time, and you can always contact me on my number, which is 768-3791. Have a great day.